Good evening. I'm here tonight to inform you of a disorder that by definition consumes your life. We may leave home after dinner and forget whether or not we've turned off the stove. Most of us would circle back to double check. For millions of Americans who are affected by obsessive compulsive disorder, these tedious thoughts tend to overtake their mind and can have a negative effect on one's daily life. According to the National Institute of Health, OCD is an anxiety disorder in which one has unwanted and repeated thoughts, feelings, ideas, and sensations that make them feel the urge to do something. The most significant piece of information I believe I came across was how people with this disorder often don't tell others about their symptoms because they usually don't realize they have a diagnosable illness. In this speech, I will increase your awareness of OCD by introducing you to the signs and symptoms, diagnostic procedures and treatment, and recovery methods. We will start by discussing the etiology of OCD. There are several theories as to the actual causes of OCD, but none have been proven as of yet. Some professionals hold that OCD stems from biological causes, such as low levels of serotonin and genetics. Other professionals believe that environmental factors play a role in the onset of OCD, such as abuse, illness, death in the family, changes in living situations, or even relationship concerns. Most professionals adhere to the theory that a combination of both biological and environmental factors contribute to the development of OCD. There are a number of signs and symptoms, as well as disorders related to OCD, that just might have you wondering if you or someone you love has the disorder. Signs or various indicators that a person may exhibit that has OCD are red, chapped hands, anger caused by things not being in a specific order, repeating rituals, severe perfectionism, and hoarding. Related disorders vary and are spread out across the obsessive-compulsive disorder spectrum range. To name a few, trichotillomania, also known as chronic hair pulling, skin picking, body dysmorphic disorders, hypochondriasis, and depression. Now, let's talk about how you can officially confirm a diagnosis of OCD. Diagnosis is usually determined by professionals through the use of personal descriptions and questionnaires. People with OCD usually recognize that their thought process is extreme, but the urge to perform the compulsion is intolerable. Refusal to shake hands, or touching doorknobs, eating in a specific order, repeating acts several times, such as washing hands, locking and unlocking doors, and counting. Professionals often use the Yale-Brown Obsessive-Compulsive Scale to help with the diagnosis of OCD. Mental health professionals can diagnose and treat OCD, including psychiatrists and psychologists. Treatment of patients with OCD can be very beneficial, especially if they have a support group. Selective serotonin reuptake inhibitors, such as Prozac and Paxil, are often used in conjunction with cognitive behavioral therapy, where the patient is exposed to triggered situations and learns gradually to tolerate the anxiety and resist the urge to perform the compulsion. This has shown to be the most effective psychotherapy. Electroconvulsive therapy may be used in severe cases. Recovery can be long-term, but should improve daily living. Learning to accept uncertainty and imperfect outcomes, approach discomfort head-on, and maintaining appropriate exercise, nutrition, sleep, and work-life balance. Obsessive-compulsive disorder mimics a vicious cycle of performing a compulsion to alleviate anxiety about an obsessive obsession while causing more anxiety from the lack of satisfaction. Paying careful attention to the signs and symptoms of OCD can help quicken the diagnosis and give toward a better outcome. If someone you know has OCD, please show support. Don't be judgmental, just be encouraging. That concludes my discussion, my informative speech on obsessive compulsive disorder. If I have any questions, you're more than welcome to ask.
Sure. What is the outlook without treatment of OCD?
Left untreated, OCD will continue indefinitely. Without treatment, generally only about 10 to 20% of OCD sufferers have a spontaneous remission of symptoms.
Okay.
Anybody else?
Yeah, I got a question. Will stress cause your OCD to be worse?
That's a common question. That's a good question. Yes, it is typical for OCD symptoms to worsen during stressful periods. So
Okay.
yes, it can increase the symptoms. Anyone else? Yes.
If someone's parent has OCD, what are the chances that that child will get OCD as well?
That's another good one. In general, only about 10% of relatives of people with OCD have the disorder. If both parents have the disorder, the chance is doubled to about 20%. Thank you all for joining me tonight. I look forward to seeing you in my next speech.
That was very important. I identified 3 family members. Would you like to know their names?
I know their names.
When you first started out, I was thinking, oh Lord, this sounds like dementia. Forgetting stuff. I was going back home.